Hey, good people of Buffalo and Western New York. This is New York State Assemblyman Patrick Burke. I'm starting a video series on COVID-19, and really the goal is to answer as many questions as we can. My office is getting a lot of emails and calls, and often it's the same types of questions. So what I'm trying to do is reach out to experts for this video series, pose the questions to them, and have them answer and reach back to you, as many people as we can. So today we have Dr. Gale Burstein, who is the Commissioner of Health for Erie County and has really been on the forefront of this fight in our local community. So we're really appreciative that she could come on and answer a few questions for us. Okay, here's the first question. If the cases are going down statewide, why aren't we seeing that in Erie County?
Where we are in Erie County in terms of our epidemic is a different place where they may be in other parts of New York State, such as downstate, the New York City area, or in other states. So we know that we're about anywhere between 2 to 6 weeks behind the epidemiology curve of COVID-19 in the New York City area. And we know that the governor comes out with press conferences every day to update New Yorkers about where we are with COVID-19. And he talks about, the epidemic they've had downstate, and he talks about the numbers hopefully leveling off. However, we're not at that place yet, and we don't know when we will be there. And we know that we will never get there if people don't continue to practice the good social distancing, staying at least 6 feet away from other people, keeping your mask on when you go outside. Some type of facial cover should be made out of cloth or, something that tightly covers your nose or your mouth, staying away from people that are sick. If you're sick, staying away from other people. So that's the only way that we're going to be able to get to a place where the number of cases of COVID-19 are going to start going down.
Good point, Dr. Burstein. Thank you. And really, this thing comes in waves. So we saw these huge peaks in Italy, in China. We're seeing it in New York City, and we're trying to really flatten it so it doesn't happen to such an extreme degree here, but we're really a couple weeks behind them. So it comes in waves. These other areas have been getting hit harder and earlier, and we do expect ours to come. And hopefully, with the good work we're doing and the social distancing we're doing, it won't be nearly as bad. Now, the second question. How is the capacity of hospitals in Erie County looking compared to the number of patients being admitted? Are our hospitals here overwhelmed?
Well, our hospital here are very smart, and they're working very hard to make sure that they're keeping up their bed capacity and ICU and ventilator capacity with the demand by the admissions of to the hospital from the community. Right now, they report they're in a good place. They're able to keep up with the demand, and they're also working on planning ahead to increase their capacity. So they're increasing the number of hospital beds, they're increasing the number of ICU beds, and they're increasing the number of ventilators that are available. Also, the hospitals have created a secondary hospital type situation called a subacute care facility. So those are for people that have need some type of supervised care with COVID-19. However, they don't necessarily they're not sick enough to need a full onboard admission to a hospital, either an intensive care unit bed or some type of medical surgical bed, but they're just not quite well enough to stay home. So the hospitals all the hospital systems have opened up those type of facilities too. So that's another strategy to increase the number of available beds for people who are ill with COVID-19. And so, we have time on our side right now. So the more people participate in the social distancing or the physical distancing and the other non-pharmaceutical interventions like wearing a mask when you go outside, the more our curve will be, we call smushed. And so it'll be flattened and then pushed out. So it'll give our peak will be pushed out more, and it'll give the hospitals even more time to increase their bed capacity and including their ICU beds and their ventilators. And this is what we want to do. We want to push that peak out and make it as flat as possible. So again, that takes everybody in the community working together. So right now, the hospitals say that they're able to admit all patients that need all levels of care in our community. And so we have to keep doing what we're doing with our social distancing to keep continue that as a reality.
Thanks, Dr. Burstein. I'm glad to know that our hospitals at this point are keeping up with this crisis. The planning and implementation by the hospital executives has really been good. I've been in touch with many of them over the last several weeks. And of course, our frontline healthcare workers have been heroes and been doing a tremendous job. And like you said, Dr. Burstein, the only way we get through this safely and appropriately is to continue to flatten the curve and to continue social distancing so we don't see a huge spike in hospitals and hospital stays and treatment of COVID-19 where we become overwhelmed.